If you're on Medicare or you will be soon, this is a big deal because starting in July 2026, the government is finally opening the door to weight loss drugs like Wegovy and Zepbound. But before you get too excited, there are some very important details that you need to know. And honestly, this is not as simple as Medicare now covers GLP-1s. So let's break it down. Hey everyone, welcome back to the channel. For years, Medicare has not covered GLP-1 medications for weight loss, even though they help people lose significant weight, they improve blood sugar, and they lower the risk of heart disease. But the biggest barrier? Cost. The medications can run $1,000 or more per month out of pocket. So this new program from the Centers for Medicare and Medicaid Services is trying to change that. This is the first step and it's temporary. From July 1st to December 31st, 2026, Medicare is launching something called the Medicare GLP-1 Bridge. Here's what that actually means for you. You can get GLP-1 meds for $50 per month. It's available nationwide. It includes drugs like Wegovy and Zepbound, but it's not run through your normal Part D plan. Instead, it's handled through a separate system with a central processor. Translation, this is basically a test program. Let's take a look at who actually qualifies because this is where things get more restrictive. To qualify, you generally need a BMI of 35 or greater, or a BMI of 30 or greater with conditions like high blood pressure, kidney disease, and heart issues, or a BMI of 27 or greater with a history of prediabetes, stroke, and heart attack. And you must be on Medicare Part D. Your doctor has to submit a prior authorization, and you must be doing lifestyle changes like diet and exercise. So no, this is not open access. Here's the part that no one is really talking about. This program is temporary. It ends December 31st, 2026. If you want to keep access after that, you'll need to enroll in a Medicare Part D plan that participates in the next program. Starting January 2027, Medicare rolls out something much bigger. The balance model. Balance stands for Better Approaches to Lifestyle and Nutrition for Comprehensive Health. This is where things could really change. What's different? Medicare will negotiate drug prices directly. Coverage will include GLP-1 medications and lifestyle programs like nutrition and exercise support. It expands access for both Medicare and Medicaid, but here is the reality. It is voluntary. Plans have to opt into it. Drug companies have to participate. So coverage is not guaranteed for everyone. Let's simplify all of this. The 2026 Bridge program is short-term access, $50 a month, strict eligibility, and temporary. The 2027 balance model is potential long-term coverage, more structured support, and still depends on your plan. Here's how I see this. This is a huge step forward, but it's not a magic solution. We're finally seeing recognition that obesity is a medical condition. These medications can help those, but we're also seeing restrictions, temporary programs, and of course, a lot of uncertainty. And if you follow my channel, you know these medications are powerful tools, but they're not the whole picture. And of course, I'm really curious how you guys feel about this. Would you consider using a GLP-1 if Medicare covered it? Or are you more cautious about these medications? Let me know in the comments. I read every single one of them. And if you want honest, real talk discussions about weight loss meds and what's actually going on behind the scenes, make sure you're subscribed. I've got a lot more of these coming. If today's video helped you, don't forget to like and subscribe. Thanks so much for watching, and I'll see you in the next video.